Hi, I'm Cammie with Just Brooke, and today we're going to talk about Medicare. I've been a registered nurse since 1993. I have 15 plus years of case management experience. I have run companies in the medical field, and I also have my insurance license. I'm definitely not going to sell you insurance, but what I do want to tell you about is Medicare and how it all works, because I have many years of experience from many different angles. So Medicare Part A, B, C, D, what does all this stuff mean? There's like so much information out there. When you're turning 65, it can be very overwhelming because you're used to having your employer insurance up till this point, and you kind of had a couple of choices. And anyway, what does all this Medicare stuff mean? So Medicare Part A, there's no monthly premium. There's a deductible of $1,600 per benefit period. That's not per year. That's per benefit period. So if you admit to the hospital 61 days later, you admit again, you're going to be paying that $1,600 again. And it also covers your inpatient stay is what it's listed under. However, what it covers is room and board. It doesn't actually cover your whole stay. It does not cover the services. So Medicare Part A by itself is actually very little to no coverage. And so, but you do need it, but don't think Medicare Part A is going to pay the things that you need to be paid for. So Part B, the average monthly premium at the time I'm making this video is $164.90 per month. That is determined by income. And the deductible is $226 a year. So be checking those numbers if you're listening to this after 2023. So what does Medicare Part B cover? Medicare Part B covers outpatient services like going to the doctor, lab, x-rays, physical therapy, and the services you receive in the hospital. So it's very important to have both. There's an 80-20 split with Medicare. So Medicare is going to pay 80%, you're going to pay 20%. So if your bill's $100,000, your part's $20,000. So it's very important to also sign up for a supplement or an advantage plan, even if your health is good, because you never know if you have a wreck or something happens. So you don't want to be paying 20% of the bill. So if 1 year you're in the hospital, then you go to a skilled nursing facility, your bill might be $100,000. Your part of that will be $20,000. So that's just outrageous. Then there's Medicare Part C, and those are advantage plans. When you go to www.justbrooke.net, JUSTBROOKE.net, go to my shop, go to medical. Under medical, it's medical part 7. That's the 7th part of my medical series. Open enrollment is the picture you'll look for, or how Medicare works is the wording you'll look for. I'll explain how Medicare supplements and advantage plans work in detail, and which ones you actually give up your Medicare rights and sign up for a private insurance, and you have medical directors deciding what care you're going to receive and not receive, and the pros and cons to advantage plans and supplements. Also, Part D is your drug plan. Even if you're not on medicine now, you should go ahead and sign up for Medicare Part D, because if you get on it if you get on medications in 6 months or a year or 2 years after you're age 65, or you lose employer coverage through yourself or your spouse, you're going to be paying the monthly premium, and you're also going to be paying penalties for the rest of your life. And that is how it is with Part B also. If you don't sign up at the right time, you will be penalized for the rest of your life. Anyway, so meet me at justbrooke.net, JUSTBROOKE.net. Go to medical part 7, how Medicare works, and look for the open enrollment picture, and I'll be glad to help you, and I'll explain it more in detail. Also, if you go to the death and dying under medical as well, I have resources for some extra help, possible free help, and a little bit of information on how Medicaid works as well. So I will see you then. I definitely want to help you. This is, I know, a very stressful time in your life. I've helped hundreds of people at this time in their life, and then they're second guessing themselves when they're in the hospital about did they choose the right plan, not choose the right plan. So if you need a one-on-one, you're welcome to also contact me at justbrooke.net. There's a contact or an appointment area. You can click on either one and schedule a one-on-one appointment with me if you need some special individual help. Thank you so much, and good luck to you. Bye-bye.